let's first take a look at what is in and what's open and what's not in Lockdown 4, at least as far as the central government's order is concerned, because individual states can decide what they want to do. So no domestic and international flights are allowed. That continues even now. No metro rail services, no malls, no large gatherings, shops and markets with staggered timings. School colleges shall continue to remain shut. Hotels, restaurants will be open, but only home delivery. Only home delivery. Those above 60 and children below 10 are advised to stay home. In Delhi, in fact, the Chief Minister said that it will be considered illegal if they step out. Interstate vehicular movement has been allowed with the consent of states. So the states have to agree. That has in fact been allowed. Sports complexes and stadiums without spectators. That means tomorrow if there were to be a match, there will be no people to cheer. Of course, you can watch it on TV. And non-essential e-commerce has now been allowed except in the containment zones. Now let's take a look at a very, very important graphic, because see, after having allowed or disallowed, see, this is a very liberal lockdown, right? Of course, the intention was that maybe the achievements have been, the target, the reason why these lockdowns came into existence, that target has been met. What was that target? To flatten the coronavirus curve. Have we flattened the curve? Well, as of now, in a little while from now, the way things are going, India will reach 1 lakh corona cases. 1 lakh coronavirus positive cases. Many of them have recovered also, but the total number of cases stands at 99645 as of this moment. So this, I will leave it to your better judgment on whether we have achieved the intended purpose of a lockdown. Let me quickly welcome my first guest, Dr. Rakesh Verma, Additional Director General of Health Services, Government of India. Dr. Verma,
good evening.
Lockdown was necessary. Everybody agrees lockdown was necessary, but could it achieve its intended purpose?
See, lockdown had multi-pronged strategy. We were having several aims before lockdown was announced by the Government of India. And largely, the goals have been attained and achieved. See, we can never be satisfied so long as the graph of pandemic keep on increasing number of cases. But certainly, we can say with some degree of satisfaction that some goals have been achieved. Ultimate goal will be to totally eradicate this pandemic of COVID-19 from the country once for all. But at least till to date, if you see, the country has got a population of 130 crores, out of which we still are some short of 1 lakh. That is quite satisfying for us. As well as the recovery rate is hugging almost 40%. This is better than any other country in the world. We are very satisfied. Although we want to contain the deaths much, much more, and the Government of India is doing all its efforts to contain the rapidly increasing graph of COVID patients.
Correct.
But considering our geo conditions, considering the diversity that this country has got, this is quite satisfactory. It could have been better. We want to do better, and we assure you that we will do better.
Correct. Dr. Verma, very quickly, I want to ask you, if this is not a flattened curve, which it isn't, and we could have achieved a lot more, but we are not way off. In fact, we could have been a lot worse. Everybody knows, everybody knows the truth. We did increase our capacity building. All of that is understandable. My only point is, what else needs to be done as of this moment to achieve the intended purpose?
See, in this disease, as we have already discussed several times, the prevention is the cure. Bachao hi ilaj hai. Unless the 130 billion crore people of this country understand this, no doctor can save them. It is they themselves who have to save themselves. They don't have to get out of the homes. They don't have to go to places where it is not required. So long as it's not really compulsory, we have to save ourselves only by our protection, by using medical and social distancing, by using regularly use of mask when we are coming in contact with any stranger or any new person, cleaning our hands with soap or sanitizer as and when required, as and when we get out of the house and touch any new surface. That could be handle of the bus, that could be car handle, that could be our steering, which has been used by other people also. If we follow that norm, it will be preventing the disease once for all to very large extent. That is what is maximally required. Social crowding is what is troubling us. Social overcrowding is what is defeating the very aims of this government. But unless and until we maintain a personal hygiene, we maintain a medical distance of about 6 feet or 8 feet from another person, we start using masks all the time when we step out of the house, we cannot achieve those goals. And I request through your channel, all of us means all citizens of this country must follow, abide this situation, as we always used to see behind.
You talked about a multi-pronged strategy. I want to ask you if you could tell our viewers what the multi-pronged approach was in terms of attaining the goals as far as lockdown is concerned. Because the lockdown has been relaxed. Lockdown has been relaxed. But if it is being relaxed, why? On what basis is it being relaxed?
See, the relaxation is because of several reasons. One, this prolonged lockdown was causing a kind of another psychosis in the public in large. If you see that when about 10 days back the liquor shops were open, suddenly there was overcrowding as if the Amrit is being sold. There was over rushing there. People were almost required to be controlled by the police. So everything needs a change and progression toward normalcy. After all, lockdown is not a normal thing. So the country has to come to a normal thing. The businesses were required to be started. The laborers required a job. Shopkeepers required the shops to be open and their earnings were required. So that thing was very, very much called for. So one purpose of lockdown was sudden containment immediately, because this virus was very contagious. It is very contagious. Its profile is not known. It is absolutely new one. That's why the name is new COVID. It's a coronavirus, but a new one. The way it was multiplying. The people are not aware.
I understand. I understand. And thank you so much for explaining to us that this fight is long. But the point is that a lot was unknown about this virus.
Is being done. Simultaneously, a lot of new medicines are being tried, including plasma therapy. Vaccination is being tried. New vaccines are being developed, tried to be developed. It may take a couple of months. But unless we start now, unless we have started 2 months back, we would have been lagging behind. So those all are things that are happening.
Okay. Dr. Verma, many thanks for joining us on this discussion number 1.